Welcome to this month's webinar. Robin Glock, RN, she's a health coach with Orthus Health. She will be presenting this month's topic. Robin?
Hi, thank you for joining in for the December webinar, which is Preventive Care and Screenings. Today we're going to talk a little bit about what is preventive care. It's an important step to managing your health. It's an opportunity to find problems early for effective treatment, and basically a visit to the doctor when you're healthy. Preventive care is the care that you receive to prevent illness and disease. It also is counseling to prevent health problems. Providing these services is based on the idea that getting preventive care, such as screenings or immunizations, can help you and your family stay healthy. It may also reduce your health care costs down the road if you catch a problem early or if an immunization keeps you from getting a serious illness. Check with your healthcare provider and the insurance for costs and copays related to your preventive care. Some examples of preventive care include wellness visits. These are usually visits that are done once a year. There are also standard immunizations, things like the annual flu vaccine, the shingles vaccine, screening tests, checking your blood pressure, your cholesterol numbers, checking for type 2 diabetes, which would be a check of your blood sugar and the A1C, checking on your risk of obesity by knowing what your weight is and calculating a BMI, and then also doing some preventative care for cancer, checking screenings for things like colon cancer, prostate cancer, breast cancer, etc. So let's talk a little bit about the focus of the visit. The exam is prevention focused, not problem focused. So you'll receive a complete physical by your provider, and they'll also review your past medical history along with your family history, a review of medications, and we encourage you to bring a list or the actual medications with you, and then review of age and gender appropriate screening tests. What to expect. You're going to have your provider be listening to your heart and lungs, listening with a stethoscope. They may hear an irregular heartbeat, a heart murmur, or other clues to heart disease. And then with the lungs, they're listening for crackles, wheezes, change in breath sounds, clues that there is problems with both the heart and lungs. They'll do an inspection of the ears, nose, and throat, also taking a look, feeling around your sinuses, your lymph nodes, and your neck, your thyroid, and even your carotid arteries. A skin check for unusual moles or rashes, anything that kind of pops out at them and says this doesn't look normal. They'll do vital signs, blood pressure, heart, respiratory rate, and also check your height, weight, and calculate your BMI. Having these things done opens up a discussion for risk factors that you may be more at risk for depending on those findings. Now we'll talk a little bit about the male physical exam, and this includes things like checking for any lumps or changes or areas of tenderness that would be in your testicular area. They'll do a hernia exam, checking for areas of weakness between the intestines and the scrotum, sort of that turn and cough. They'll look for any signs of sexually transmitted diseases. And then depending on your age, they'll do a prostate exam, which is basically feeling for size and changes on that prostate done with a rectal exam. The female exam is a breast exam, feeling for abnormal lumps, lymph node examination in the underarms, and then just a visual check of your breast area. Also included with the female exam is the pelvic exam, which is a Pap test, the HPV, looking at cervical cancer, and then an internal exam, feeling and checking the uterus, cervix, and the ovaries. Another screening test to consider is the colonoscopy plus other fecal exams that can happen. Colorectal cancer almost always develops from precancerous polyps, which are the abnormal growths in the colon or the rectum. So there are some screening tests that are used to find these precancerous polyps so they can be removed before they turn into cancer, and also looking at the right time frame and the right test for you. So the stool DNA test is a new type of non-invasive test to check for colon cancer and rectal cancer, and it is available now, and it's something that the FDA did approve back in 2014, and it is for those people, and it appeals to people who don't want to do the typical screening but want to kind of undergo and avoid that usual prep that is required for the colonoscopy. And the reason it's called the stool DNA test is because it looks for certain gene changes that are found in colon cancer and rectal cancer cells. And it's a take-home kit. You collect a stool sample, you mail it to the lab, and then that does, check the test, looks for DNA changes that could be a sign of cancer or precancerous growths, which are the polyps. It has no special diets or bowel prep, no laxatives or enemas, and so it does seem a little bit more appealing than the colonoscopy. Another test that they'll look at is the guaiac-based fecal occult blood test, which we just call the hemoccult, and those tests are used to find tiny amounts of blood in the stool that could be a sign of cancer or a large polyp. This is also a take-home kit that you receive from the doctor, and then if you do have a positive result, that will lead more than likely to a colonoscopy. Although sometimes there are some non-cancerous conditions such as ulcers or hemorrhoids that can show some microscopic blood. It's always best to check in and see what the next step would be for you for screening. And then lastly, the colonoscopy is that flexible lighted tube, and it is used to go up and look into the colon. You do have to have a bowel prep for that. You will be on a special diet. You'll need to clean out your colon with some laxatives, even potentially enemas, depends on your doctor. And then you'll be sedated. They'll take a look in there, and if nothing's found, usually the rule of thumb is 10 years, but that's going to be based on family history, as well as your own personal history and what your doctor thinks is right for you. And again, the time to begin thinking about this and having that discussion will be at age 50. For some women, age 40 marks the time to begin annual mammogram screening for breast cancer. And so that annual mammogram is recommended for women age 40 and above. If you look at the American Cancer Society, there are some variations to that recommendation, and that's something that you can decide what's best for you with your healthcare provider, and how long the screenings go on for is also determined by your healthcare provider. Breast cancer is sometimes found after you have some symptoms, but many times there aren't any symptoms, so it's diagnosed and it's found during your annual mammogram. And so finding out during a screening exam, you're more likely to have a smaller area still confined to the breast and kind of get that in an early fashion so that treatment is and prognosis has a better outlook. They find that at an early stage where it is more successful treatment-wise. Screening for cervical cancer, and that is for women aged 21 to 65. The recommendation is a pap smear every 3 years. And then for those who want to prolong or push out that time frame, women ages 30 to 65 can have a pap smear and HPV testing, which changes that to every 5 years. Still recommending that you have an internal exam yearly and focusing on what's best for you based on your recommendations for your doctor. Now we'll talk a little bit about screening tests for prostate cancer. Prostate cancer is the most common cancer in men, not counting skin cancer. Many of the risk factors for prostate, such as age and race and family history, you have no control over those, but there are some things that you might do to lower your risk. So prostate cancer can often be found early using the simple blood test, the PSA, which you'll see on the screen here. And it talks about the age that you start. Men aged 40 to 49 should have a baseline PSA test, which is that prostate-specific antigen. The level that comes in at less than 1 requires no further screening recommended. 1 to 3 is asking for every 2 to 4 years. And then a level greater than 3, talk with your doctor about a possible biopsy of the prostate. Because of the PSA testing, it's important to talk to your healthcare provider about any questions that you have, risk or potential benefits of having the screening done. If the result of one of these tests is abnormal, you'll probably need to have a prostate biopsy at some point, and that's going to be determined on what numbers your doctor feels correlates with the need for a biopsy. If you are going to have a prostate biopsy, it's important to know that, usually they'll go in and do a prostate exam and then set you up for the biopsy in the office. Now we'll move into immunizations. Your need for immunizations doesn't end when you become an adult. Immunity from childhood vaccinations can wear off, and you may be at risk for new or different diseases. Vaccines and their recommendations can change over the years, and certain vaccines may not have been available when you were a child. So it's important to make sure your adult immunizations are up to date. And if you are pregnant or planning to become pregnant, it's important to talk with your doctor about the immunizations that are right for you. Throughout your adult life, you will have a need potentially for the seasonal flu vaccine. That's something to take into consideration on a yearly basis. Now, starting in October, even sometimes early September, they're looking at getting that flu vaccine administered, a shingles vaccine for age 60 or older. The Tdap vaccine is needed once, but the tetanus is usually updated every 10 years. The pneumonia vaccine, beginning at age 65 or older if you have high-risk conditions. And then the hepatitis B vaccine is something else to consider for high-risk or diabetic patients. Now we'll kind of go into some of the screening tests that you'll see at your doctor's office, even your dentist's office. The first one is the blood pressure. They would like that to be checked in adults 18 years or older. The normal reading is to be less than 120/80. And to really know a true number, they recommend obtaining measurements outside of the clinical setting to kind of know if you're having a higher blood pressure in the office. It's related to maybe just the stress of being there. High blood pressure is a very prevalent condition, affects about 30% of the adult population, and it is commonly diagnosed when you're at the doctor's office. It is a major contributing risk factor to heart failure, heart attack, stroke, and kidney disease. And a lot of times, because there's no signs or symptoms, you don't realize that you have high blood pressure or that your pressure is above the norm. So it is important to check that, know what your numbers are so you can see if your numbers are trending higher and let your physician know. Another screening test that the American Heart Association recommends for all adults age 20 or older is to have a cholesterol panel or a lipid panel. And that should be checked every 4 to 6 years or more often, depending on your family history or current health history. That lipid panel looks at the total cholesterol, your HDL, your LDL, and your triglycerides. Type 2 diabetes is very common. It's a very serious disease in the United States, and it is thought that about 1/3 of those who have type 2 diabetes are unaware that they have the illness because there are often no symptoms. So early screening can actually help people avoid serious complications of having a high blood sugar over a long period of time. And that can lead to long-term damage of your eyes, your kidneys, your heart, and your blood vessels. And you also, with undiagnosed diabetes, have a higher risk for stroke, coronary heart disease, and peripheral vascular disease. So the recommendation for the fasting blood sugar is, they'd like your normal should be less than 100. If they're checking a hemoglobin A1C, which is the 3-month average, they'd like that to come in at less than 5.7%. They use that test a lot for diagnosing pre-diabetes and diabetic states. And then the recommendation is every 3 years, have that done starting at age 45. Obviously more often depending on your family history or what your current numbers are, just to keep closer tabs on that. On this screen, you'll see the BMI chart. It's a calculation of your height and weight. It shows you what the BMI numbers are in relation to the weight status that they hold. It's a screening tool, and it is not diagnostic of body fat percentage or your actual health. To determine if your BMI is a health risk, you would have to work with your healthcare provider who would potentially perform more tests, perhaps a skin fold thickness measurements, waist measurement, evaluation of your diet, your activity level, and taking into consideration your family history to determine if your weight is a risk factor for having some chronic disease problems. So at the end of the day, a lot of this is just about moving towards better health, getting more physically active, making exercise a priority, taking the time, and getting in that recommended 150 minutes of moderate intensity exercise. That can be broken down into 30 minutes, 5 days a week, or even as small as 10-minute increments 3 times a day. Try to figure out what you like to do, what you have interest in, maybe gain some support from friends or coworkers, join a gym, take an exercise class. Think of ways that you can integrate more steps into your day and just be more physically active. Eat balanced, so start to think about the food groups and how you're eating, and is there some ways that you can clean up your food intake and make, better choices, thinking more along the lines of fruits and vegetables, whole grains, low-fat dairy, lean proteins, and just looking at sort of the outskirts of the grocery store and less focus on the inside, more processed foods. Another area to consider is maintaining a healthy weight. Even, a small reduction of 5 to 10% reduction in overall weight can have a big impact on your numbers and your overall health. So thinking about, if that's something that would be right for you. And then focusing on being tobacco-free, talk with your doctor about smoking cessation, the availability of help to get you on your way to quitting. There's also working with a health coach or working through different programs with your physician. This concludes the December webinar for preventive care and screenings. Remember to check out the My Pathway to Health website. It does offer many education materials in the health library. There's also interactive tools and calculators. And to take advantage of working with your health coach, we are available in here to help you with any health goals that you may have, and it would be great support to have on your healthy journey.